Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD, and I'm talking to our Health Equity Office. Ladies and gentlemen, would you just introduce yourselves?
I'm Lois Gwen, the Senior Program Administrator.
I'm Scanlon Anethaseker, an outreach educator.
My name is Sequoia Cheney Williams, and I'm an outreach educator as well.
Thank you for that. It's always better when you introduce yourselves. Now, we're talking about National Public Health Week. That's occurring right now this week. It's April 3rd through the 9th. And your department here at MCHD, you all are heavily involved with this week. So can you tell me what you're doing for National Public Health Week?
I'll start, James. National Public Health Week has been celebrated for the last 28 years. And we are just so proud to recognize and honor the individuals who have been working in this area for the last 28 years, many more years than that, but to recognize them because it's not an easy job. Serving those that underserved and those that are less fortunate. And this week, we are celebrating and seven themes throughout the week. They are community, and community is where we live. It's our built community. It's an area where people come together and celebrate and support one another. It's an area where, if we actually work together, or the community works together, they can build a very strong neighborhood. Another theme is violent prevention. Even you heard this morning on the news how Mobile has been rated as one of the most violent cities in the country. And violence has been increasing and on the rise ever since the pandemic, especially gun violence. And that is an area that everyone is very concerned about. We are actually working with Joshua Jones, who is the city youth violent prevention coordinator. He is looking to develop what he called a community eco center, where he wants to surround the youth by building up their self-esteem, surround them with community members who can support and encourage them. And also the third leg to this program is their families. So we're working with him and providing information, and we're actually going to participate in a youth violence prevention program during spring break, which will take place April 20th. Another theme that they're focusing on this week is sexual and reproductive health. In the news, that has gotten a lot of attention, especially since the repeal of the Roe versus Wade Abortion Act. There's been a lot of communication in the news about sex affirming treatment. We are just concerned that everyone, regardless of their sexual preference, their ethnic background, that they should be able to have access to the reproductive health that's important to them. Another fact that we see here is also that African American women are 3 times more likely to have complications with pregnancies, and that needs to be looked into. The theme for Thursday is mental health. Mental health is really big. We've always had health problems with mental health, but it has become more exacerbated since COVID. We've noticed that there has been a rise in suicides, especially among the African American and Hispanic communities. When you look at part of the reason is there's such a stigma associated with mental health, and people are really hesitant to go out and seek that help. But we want to encourage everyone who may be suffering or have family members to reach out and get the help needed Sequoia is going to share with what we're doing with the school system and as part of our school tours. But early on, the department conducted a community outreach survey. And one of the main issues that came back as a priority for our citizens was mental health. So this past year, the Health Equity Office had several events focused on mental health, and we will continue to do that. We want to encourage people, if you have family members who have heart issues, you take them to a cardiologist, and there's no shame in that. And that's the same as it relates to mental health. Another theme that we have this week is dealing with accessibility. And that's whether individuals will have the chance to have access to health. I'm going to say to healthcare. And also we notice, we have many individuals in our community who have disabilities, and we want to make sure that those individuals can have proper and adequate health care as well. On Friday, the theme will be rural health. And rural health, with the closing of many of the critical access hospitals and providers that are in the rural areas, that's causing a real issue. And also individuals in rural areas, the socioeconomic impact is like a domino effect. Individuals living there, probably aren't making as much money. Many of them are not finishing high school. There's a concern about not having health insurance. And then they are working at minimally paid jobs. So all of those things can add to stress. And as a result, we see that in many of the communities, in rural communities, that tobacco usage, there's also an opioid problem in that area, and high diabetes and other chronic illnesses are common in those areas as well. And with all of that going on, they have the issue of transportation, being able to get to proper health care. So we are focusing on that area. We are working in the Bayou La Battery, the Citronelle area, as well as with the MOWAs, offering outreach events. And then on Sunday, the last theme is food and nutrition. And we all know that it's difficult, I'll say, to be healthy if you don't eat properly, have a well-balanced diet. And in many of the underserved areas, they are considered food deserts. Many of them don't have grocery stores where they can purchase fresh produce, and most of the things that are available are processed, and those processed foods add to the problem with high blood pressure, heart issues, and diabetes. And our department has been very active in food distribution in Bayou La Battery, Africatown, as well as the Dodge Center here in Mobile. And what I'd like is for our team to talk about some of the things that we're doing in that area. And when we talk about community, I'd like Scandon to share with you about the ESRI project system that we just released and how that affects and can be useful in the community.
Yeah, so I can talk a little bit about our Health Equity Hub. So this is something that was built in collaboration with ESRI to bring more data and awareness to both the community level and also stakeholders, including policymakers. So this hub can be found on the MCHD website, but basically there's two main aspects of this dashboard. One is a resource locator. So what you can do with this resource locator is put your address into this map essentially, and it shows you resources that are around where you're located. So this can include healthy eating, places where you can go to buy healthy food, parking, walking trails, and also hospitals. So just a wide variety of resources that are important for your health. And another thing that the resource locator can be used to is to show a lack of resources um, around where you live. So this can be used to advocate to policymakers, hey, look, in this rural area, in this area, there's a lack of healthy eating places. So, that's something that we need to look at. And then the other part, the other major part of the hub is the chronic diseases. And this shows the prevalence of certain chronic diseases such as diabetes, hypertension, and mental health. And more importantly, how these chronic diseases overlap with certain risk factors. So what you can do is you can type your zip code into this map and see the prevalence of these chronic diseases and look at how they interact with risk factors such as physical inactivity, obesity, smoking, and just more of other risk factors.
Yeah, there's some great tools, obviously necessary in the community. And, as far as the resources and the resource locator, that's absolutely necessary. Now, Sequoia, you were involved with our school system. So, can you tell me a little bit about those school tours and, the purpose and the outcomes of some of them?
Yes, Scandon and I have been going into the schools in partnership with Opportunities for Entertainers, which is with Mr. Kalinsky Adams, Rodney Toomer, and Miss Nina Dotch. And we've been going into the schools providing all types of resources from mental health to drug abuse, jobs, colleges, anything that the kids will need to help them when they graduate.
Mhm.
And it's been very successful. I cannot remember the number of schools we've gone in, but we've gone into Williamson, BC Rain. And last Friday, we were at Alma Bryant. And that was over 1,000 kids that we were able to reach and talk to and provide resources with, about mental health, because as we've done questionnaires, we've noticed a concern for mental health. And when we speak with the kids, they're concerned about mental health and, what are they going to do when they graduate and what opportunities are out there for them. So it's been a very successful event that we're very happy to be a part of.
Yeah, I saw some pictures that you all had provided to us from those events, and it looks like they were very well received,
Mhm.
high attendance. So it sounds like that we did meet our goals and our benchmarks for those events. So let's get back to Public Health Week. So you all, those themes, those are obviously necessary, and it's not just what applies here to Mobile County, but these are themes that have been identified on a national level. So the things that you all are doing here, it's not like they're not being done in other parts of the country. It's just good that we've recognized and we're able to spotlight and highlight these things also for Mobile County, and we're very thankful for Health Equity Office to be able to go into schools, go into communities, and go to outreaches and go to all these events. Um, that way, we're able to find out, how else can we better serve the community, but by being in the community.
Yes, yes.
One more thing I forgot
Mhm.
to mention about the school tours. The school tours are mainly been focusing on the kids, but June the 10th, Opportunities for Entertainers is going to have a big finale at Ladd Stadium, which will involve the community as well. So the parents, anybody in that community or in the community can come out and be a part of it and, get whatever resources and information that they need.
And just talking back to your point, James, about really being in the community and working with the community, I would really say it wouldn't be possible for us to do any of this work without our community partners. We've really working this year more, I say, expanding our list of community partners and engaging more deeply with our community partners and really building trust in the communities and being a constant presence in these communities. And I think one area maybe that's really well highlighted is our work on food insecurity. And as previously mentioned, we're working in 3 food drives. One is in the Trinity Gardens area at Dodge Community Center, and we're there every Wednesday. And the mobile medical unit is out there some Wednesdays, being able to provide basic health services to the participants, and I know that's something that's really well appreciated. We recently moved into the Biola Battery area to open up a food drive there in collaboration with Danny Patterson of the Equitable Neighborhood Initiative, and working more with our Asian American population to make sure that they have some of their nutritional needs met. And then also working with the Africa Town neighborhood, doing a food drive there. So I think that one area just really highlights how working with our community partners, we can do so much more.
Mm-hmm. Yeah, and I think well, I guess my hope is that as people learn more about National Public Health Week, that they see that the medical aspect is just a very small part of public health. There are so many other pieces here that involve public health that people just aren't aware of. And who is in the forefront of that in the community? Well, that's us being public health. So I'm glad that we're able to put a spotlight on not just us for this week, but these needs, and also the assessments that you all are doing in the community. It's you can't lose when you do these things. That's everyone wins.
Yeah.
Is there anything else you all would like to add about what you all are doing in the department, or anything that you'd like to see, any benchmarks or anything like that you'd like to see happen before this time next year, next community, public health week?
Well, we know that we will not be able to resolve all of these issues in a year, 5 years, but we're looking at it from the aspect of how do you eat an elephant, one bite at a time. And we're considering and looking at every small win as a victory. The fact that we are expanding, I said, when building these new partnerships in Africa Town. We are looking to also expand our reach into Citronelle, Sims, and Wilmer area. That, those are areas that we haven't done very much. We are very pleased to be able to have the partnerships that we are having now in Biola Battery. Danny Patterson, when he heard about our school tours, he canceled another meeting so that he and his team could be a part of that. So what we're just hoping is to work with all of our partners and to increase our pool of partners and work collectively to make a difference. We haven't said much about the incarcerated and the homeless communities, but we're hoping to be able to reach them as well. And in closing, I'd just like to say for this week, we do have activities planned around many of those themes. Wednesday, we will do our school tour that's going to focus on mental illness and just community. I look at it as community, preparing our youth to be successful and to break this recycling period of, I'm going to say, disenfranchisement. And also Thursday, we want to encourage those who haven't signed up yet. We're having our stress relief bingo sessions that will be led by Sequoia. Friday, as it relates to food and nutrition, and we also look at rural health. We will do a food distribution in Biola Battery. And around community, we noticed that Trinity Garden is having an Easter egg hunt on Saturday, and that's part of bringing community together. Hopefully it won't rain, but that's what they're doing. So we'll be busy this week trying to make a difference.
Well, I'd like to close also too by going back to one of your points there, Lois. We're not expecting immediate results. Those would be nice, but we know a lot of these issues are generational, and it's going to take some time. So, it's good and helpful that we are able to plant the seed and just wait for it to mature out in the community. So, but thank you again for all the work that you're doing, especially this week and then every other, week of the year out in the community. So if someone wants to get in touch with you all with the Health Equity Office, just, real brief, just tell them how to get in touch with you.
They can, my email is lgwynn@Mobile County, MCHD.org. And our phone number is 251-405-4596. So by email or phone, we would look forward to speaking with anyone who may have concerns or questions about what we're doing and how we may assist them.
All right, well, great. Well, thank you. Thank you all for being on Wellness Wednesday. And thank you again for what you're doing in the community on behalf of MCHD.
Thanks for having us.
Thank you.
Thank you.
Thank you so much.